The Māori Council has described the latest suicide statistics as a rolling train wreck. The figures were released officially late this afternoon after the council broke the Chief Coroner's embargo originally scheduled for tomorrow. It showed there were 685 suicides in the year to June 30, 17 more than last year. Māori suicides, which were already disproportionately high, well, they've jumped further, with 169 Māori people dying by suicide in the year to June 30, up 27 from 142 deaths last year. Executive Director of the Māori Council, Matthew Tukaki, told us earlier that this is a national tragedy and there is no national strategy. He asked where the plan is. Joining us now is Health Minister David Clark. Good evening, Mr Clark. Where is the plan?
Good evening, Lisa. I just want to acknowledge at the outset those families and whānau who have lost loved ones. The statistics that are released today show the fifth year in a row that the rate has risen. But, of course, behind the statistics are the families, the brothers, the sisters, the mothers, the fathers, the grandfathers and grandmothers. And one death by suicide is certainly one death too many. And that's why we make no apology for tackling this long-term challenge we've inherited and have made the biggest investment in mental health ever made in the budget. We are taking mental health seriously.
So what specifically have you done in the last year that has lowered the suicide rate?
Well, Lisa, no one's pretending that there is a quick fix here. We all have a role to play. Government does have a role to play in providing leadership, but of course it depends upon each of us as individuals getting alongside people we know who are at risk. We have made some investments, some really substantial investments in the budget that's just gone, $1.9 billion into mental health, including money for a new frontline service that is aimed to make sure people are supported early rather than late, 40 million towards suicide prevention, including bereavement counselling.
And I do understand that, Minister, and I understand those figures because we have heard them before. Obviously, Matthew Tukaki raises the point that he would like a commission, a mental health commission. He would like two commissioners, one specifically for Māori, and he would like a zero-tolerance approach to suicide in the hospital and treatment system. Is he going to get those things?
Well, we do have a suicide prevention strategy being finalised. Obviously, there hasn't been one in place since 2016, and one of the firm recommendations from the inquiry into mental health and addiction, He Ara Oranga, was to get that prevention strategy in place. So
how far off is that, do you think?
Coming weeks, Lisa. It is quite close now.
2 weeks, 3 weeks?
We also expect to make announcements on the Suicide Prevention Office as well in the next few weeks.
Māori Commissioner for Mental Health?
Look, I won't get ahead of the announcements we're going to make, but all of the parties in the coalition have committed to having a mental health commission. It is important that we have an independent watchdog that looks at the whole system and makes sure everybody is responding appropriately. This is a national tragedy. Obviously, it hasn't happened overnight. Those rates have been ticking up over a number of years.
Can you understand?
It is the reason why we're responding in the way that we're responding and taking this long-term challenge seriously.
I don't know if you had the opportunity to hear Matthew Tukaki, but he was, well, it's three of his relatives are among the statistics that we are discussing today, and he has said that he will not stand by while another one of his people dies. Can you understand why he is so upset with the direction things are headed in, and what can you say that will give him any hope that next year is going to be different?
Well, I think all of us are upset. I don't know any New Zealanders who haven't been touched in some way in their wider family or friend network, certainly most immediately by mental health issues, but also by suicide. We have a shameful suicide rate in New Zealand, and all of us want to make that different. Having a strategy in place that guides people is really important. I accept that finding in He Ara Oranga. Having a suicide prevention office in place is important. Having a mental health commission in place is important. All of those bits of work are at advanced stages, and they have been lacking for a very long time. It is something that we accept that long-term challenge has to be tackled. It's not something that can be put off.
So, Minister, can you be more specific with the time frame? Because that is the other issue for some people. Things are moving too slowly.
Weeks, not months. Weeks, not months.
A fortnight?
Weeks, not months.
And are you ruling out a Māori Mental Health Commissioner or not? Are you leaving the door open to that?
Look, I'm not going to get ahead of those announcements, Lisa. The news today shows us that trend is still going in the wrong direction.
Particularly for Māori.
A challenge that needs to be tackled, and particularly for Māori. So we've had specific Māori input across all of our mental health work. It is an area of particular focus because we recognise that the rate there is unacceptable, as is the rate across the board.
Okay, so while we're talking about strategies and timeframes, when can we expect the cancer plan to be revealed?
The Cancer Action Plan will be revealed not very far away at all.
What does that mean, Minister? Not very far away.
Look, we've said we want to have it at the end of this month, Lisa, which is not very far away at all. So it's within about a week.
So you expect to announce this within a week. Will there be a cancer agency, a separate entity?
Again, Lisa, I'm not going to get ahead of announcements. We're focused, though, on making sure we have strong central leadership for cancer care, and because the standard across New Zealand hasn't been equal.
Strong central leadership isn't necessarily a standalone agency, though, is it, Minister? So are you committing to a standalone agency, or is it going to be something within the ministry?
As I said, Lisa, I'm not going to make announcements today, but what I am committing to is tackling the long-term challenge that we've inherited around cancer, where there has been unequal provision across the country. We don't think that's fair or right, and we're investing not just for the next few years, but for the longer term to make sure that we actually improve the standard of cancer care across New Zealand so that everybody can access high-quality cancer care, no matter who they are and no matter where they live.
Really appreciate your time this evening. Thank you for joining us. That is the Health Minister, David Clark. As you heard there, he indicated that we can expect to see a strategy around suicide within a number of weeks, not months. And he also indicated that we can expect to see, the National Cancer Plan within the next week.